One of the reasons I came to New York was to come to the New School. It was one of the few programs in the country that had an urban studies focus. And we had an assignment to go visit agencies that were helping people who had been discharged from hospitals and were living in housing someplace. One of the places we were told to visit was Community Access. It was January. It was about 3 degrees the day we went. There was an old stove, and the flames were all on to create more heat in the space. And there was about a dozen people sitting around, and somebody was fixing a meal. When I saw that, and I saw how people were living, it just sort of struck me that it wasn't the way people should be living. And maybe there was some way I could help out. It was rewarding on several levels, doing something that was improving the quality of life for a lot of people. It was very fulfilling for me. It's just stayed with me for, 35 years. Those 2 tenement buildings with the 44 apartments has now grown into over 1,100 units of housing in over 20 sites in 3 boroughs. And I think we're excited that we have fine-tuned a model that we know really works. The Gouverneur Hospital building was an amazing project. We got a lot of national attention. We won a national award for historic preservation. Late October in 2012, I don't know if it was a hurricane, it was a superstorm, but Gouverneur took on 4 feet of water, $1 million worth of damage. All the furniture was lost, the walls and everything. It's taken 16 months to build back better than what we had. Not a great thing to go through, but when you come out the other side, it feels very good. It's now been established that housing is critical to somebody's well-being. And if you do the housing the right way, it can have this tremendous multiplier effect. So now we really want to double down on what we've done and basically double the number of housing units. Our second major goal is that we can create all kinds of diversion programs that would keep people from going to an emergency room in the first place, especially younger people that are having a first episode with mental illness, to prevent them from becoming the next generation of mental patients. And then the third goal of not only training people who have been in the mental health system to go into human service jobs, but we would establish for ourselves this goal of having at least half of our workforce, 51%, be people with a lived experience. We do see ourselves in the middle of a transformation. It's working out that exactly what we've been doing is what the system needs and what people have needed for a long time. It's a very exciting time.